Having an Innovare clinician is like having a doctor in the family. We're always available, 24 hours a day, 7 days a week, wherever they are, whatever their circumstance is. I grew up around the corner. I went to medical school at the University of Missouri. I trained in internal medicine at a little program called St. John's Mercy up the street. People need help, and when you give it to them, it's very enjoyable. If you serve someone, they shine it right back to you. It is healthcare the way it ought to be, and in many respects, healthcare the way it used to be.
I've certainly had patients who would comment that we spend more time than their last doctor did with them and try to get them to know them a little bit better. We see patients all the way down to 18 years of age, and I think my oldest patient recently was 102. The longer visit appointments allow us to have conversations with our patients and try to get to know them on a more personal level and try to provide comprehensive care rather than just treating one or two problems. We try to take care of the whole person. It's very fulfilling.
I was a nurse for 11 years before I went to medical school, so I'm very patient-centric. And there are very, very few practices that I've come across in over 30 years of practice that have this kind of model of patient-centric. We just take care of the patient as a complete individual, not as a heart or a lung. We're not crunching numbers, we're taking care of patients. The nurses all know the patients know all the nurses. It's not my patient, it's not Dr. Willie's patient, it's our patient. There's different offices, but it's one heartbeat.